Teresa Fluharty has been a radiology technologist at Memorial Hospital for 10 years and in the field for more than 14. Her extraordinary skill and notable level of caring has made a difference for thousands of patients in mammography and beyond. Her listening skills and clinical instincts on one particular day, though, just may have saved a life. An injured finger caused Betty Eads, orthopedist, to order a densitometry or bone density study looking for signs of osteoporosis. She chose her preferred facility for the diagnostic test, Memorial Hospital of Union County, and made an appointment. Before the scan, Teresa, Betty's technologist that day, was completing the series of routine health history questions when Betty shared a personal fact that, while not important for the current exam, caught her attention.
As I was taking a thorough history from Betty for her bone density test, she provided me with some information that was kind of irrelevant to the bone density test regarding an injury that she had to her breast.
Teresa continued with the densitometry scan, the whole time thinking about that piece of information Betty had shared about the lump. With the exam complete, Teresa opened the conversation again on the breast lump. Betty recounted having identified a lump in her breast, but months before had experienced an accidental breast trauma carrying a load of sticks to which she attributed the lump, an annoying lasting effect. After explaining that she was a multi-skilled technologist who also performed mammograms, Teresa asked Betty if she would mind if she took a look at the spot bothering her. The appearance and texture of the lump caused Teresa even greater concern, so she asked Betty about her last mammogram.
I had a mammogram in 2007, 2008 I didn't, but 2009 I did. So that there, it goes to show you what happens.
Teresa encouraged Betty to allow her to do one immediately.
I mean, when I was up here to get the bone density, and I thought, well, you know, since I hadn't had the mammogram, just go ahead and get it too. And she said, well, yeah, we can do that. You know, I mean, she just jumped right in, you know, like it was nothing. Instead of saying, oh, you got to wait a week and get an appointment, see this and that, and she didn't do that. It's very cordial and nice, so.
The two moved to the mammography suite, where the diagnostic exam was performed, and Teresa's fears were seemingly confirmed by the clear images captured. Teresa contacted the radiologist on duty at the time, Dr. Moncrief, and asked him to look at the images immediately. The fear was founded, and he had the unenviable task of notifying Betty of the results that same day.
I was shocked. I think at that time I just went into complete shock.
Illness and medical crisis were something new for this spunky senior, and once the shock of the diagnosis wore off, she faced it with the same energy that helps her tend to her 10-acre property. The battle against cancer began, and she called again upon Memorial in the form of the hospital's oncology team. To her delight, she found the same level of individual caring Teresa had shown.
I just loved every one of them, and they just made me feel so special, you know. I thought, you know, why are they doing this good to me? I'm no different than anybody else, but that they're just caring nurses.
1 year later, Betty returned to Memorial for her follow-up mammogram. Coincidentally, Teresa was her assigned technologist. Now cancer-free, Betty's positive outcome was one to be celebrated by her family and all those who had come together as a team a year previous to make a difference in her life. An alert technologist, quality mammography images, a team of expert physicians, and a feisty 70-something woman all crossed paths that day, and a life was changed forever.
Teresa saved my life, and Dr. Scurry, yeah. I think she played a big part in it, yeah. Because she didn't shove me off, she done the, you know, the mammogram right then.
Digital technology has made the procedure faster than ever, and breast compression is individualized according to the density of each woman's breast tissue. The mammography apparatus itself has an elegant design that is less foreboding. Most importantly, digital images are clear with fine detail that aids in the detection of suspicious areas. Memorial Hospital staff even like to share the images with their patients immediately after the procedure so they can see for themselves how valuable the annual screening is.